Hi, this is Dr. Sachin Patel with Thyroid Bootcamp. Thanks for joining me on this video. Today we're going to be talking about the 7 clues that your hairbrush can provide you about your thyroid health. And when we talk about the thyroid, we have to understand that the thyroid is a gland that affects our body systemically. And so therefore many different systems can be impacted by thyroid health. So let's take a look. Besides hair loss, there's many different symptoms associated with thyroid disease. Fatigue, increased sensitivity to cold, constipation, slow heart rate, depression, anxiety, brain fog, and even thinning hair, like we're going to talk about today, can be clues that the thyroid isn't working properly. So take a look at some of these symptoms and connect with some of these. And again, you don't have to have all of these in order to have a thyroid condition, but these are all the potential symptoms that may arise because of all the systems that are being impacted by low thyroid function. The confusing thing for many patients is that sometimes you may experience symptoms of high thyroid function or hyperthyroidism based on your medication dose changes, based on your lifestyle changes, based on the changes in the demands. And so there's a variety of reasons why someone might experience hyperthyroid symptoms. And these are some of the symptoms as well. There could be some overlap. Hair loss is one of those overlaps. Another symptom might be insomnia or hyperactivity, increase in bowel frequency, which might sound like a relief for some of you, a fast heart rate versus a slow heart rate, weight loss, which is something that many of you are seeking as hypothyroid patients. So when you become hyperthyroid, then these are some of the symptoms that might arise, and it's not a walk in the park, so this can be very uncomfortable as well. The systems affected by the thyroid are vast and various, but today we're going to be talking about hair, skin, and nails, mainly the hair. When your thyroid isn't working properly, this could lead to dry, lifeless hair, brittle nails, dry skin, dry heels, but mainly the hair becomes a very obvious sign of issues because the texture might change and also the dullness or the shininess of the hair might change, and this clues us into potentially what might be going on with you. Thyroid disease, as we often mention, is not caused by a drug deficiency. So if the medication that you're taking is working for you, that's great. But if it's not, then there's a variety of different things that you can investigate further when it comes to your health to determine what else can be done to improve your quality of life. So thyroid disease can also be caused by heavy metal issues, high stress, oral bacterial overgrowth, nutrient depletions, free radical damage, digestive disorders, gene mutations, gluten and dairy intolerance, and also autoimmunity is one of the underlying mechanisms. So seek for answers in these categories if you're struggling with your thyroid issues. Now let's talk about how to test for the thyroid. It can be done in different ways. Blood work is going to be very specific. It gives us real-time demand. Basal temperature is something where you take your armpit temperature first thing in the morning, and you do this over several weeks, and we can track your temperature and how it changes over the course of a month or so. History is a really good evaluation method when it comes to your health because chances are you're telling us the truth, and you're trying to convey to us a message when you're coming in and we're taking a good history from you. So it's important that your doctor listens to your history because we like to believe the patient never lies. Functional testing can also provide some symptom evaluation as well as clues into what the underlying mechanism of the condition is. So good testing can also help reveal where the opportunities are. Now let's talk about hair loss for a moment. So 7 things that you can glean from your comb, if it looks like this comb here in this image, are that 1, you have low thyroid hormone metabolism. Chances are that's why you're in this workshop series. But it's important to understand that low thyroid hormone metabolism is something that can be addressed either through changing your dosage or through increasing sensitization, increasing conversion through the liver and the kidneys and the gut. So there's a variety of things that you can do to improve this, and your comb gives you a good indication of if that strategy is working or not. You might want to consider a medication that has some T3 in it. This would include Armour Thyroid or Nature-Throid. You can take medications that have some of the active compound in them in case you have a conversion issue. So always consider that. And that's a clue. If your hair is falling out at the roots, chances are your T3 is on the low side. Number 3 is anemia. And anemias are very prevalent in thyroid patients. This is because generally thyroid patients make less stomach acid. And when you make lower amounts of stomach acid, your ability to absorb B12 and iron becomes compromised. Specifically, iron deficient anemia should be assessed through a ferritin marker in the blood. And ferritin tells us how much there is in our iron savings account, if you will. By knowing that number, we're able to better diagnose and assess and treat for anemias. Blood sugar imbalances also account for hair loss because they increase cortisol levels, which cause a cascade of events, including decreasing T3 production. And T3 is converted from T4. When stress levels are elevated due to low blood sugar, what ends up happening is our body increases cortisol, and cortisol turns off thyroid hormone production. And this becomes counterproductive when it comes to hair growth. It also becomes counterproductive to optimally digest our food, leading to anemias. Nutrient depletion, such as iron and other nutrients, can also be a big player when it comes to your thyroid-related hair loss. One thing to keep in mind is that nutrients such as biotin being depleted can also pose an issue when it comes to hair loss. So supplementing with iron and biotin may be beneficial in the short term, but you really want to get to the underlying cause. Essential fats, when deficient, you will experience dry hair, lifeless hair, brittle hair that breaks. So essential fats are very, very critical to healthy hair and skin, and also healthy cells and hormones. So make sure you're getting enough essential fats in your diet. Also, the use of harsh hair care products can obviously damage our hair as well. So it's always good to use natural products. Coconut oil is an excellent hair conditioner and leave-in moisturizer if you choose to do that. There's also a lot of natural products that you can use that are much more beneficial for your hair and your scalp. Keep in mind that circulation is very critical for hair growth. And if your hands and feet and extremities are always cold and your nose is always cold, that's usually an indication of poor circulation. So something to keep in mind when it comes to keeping your hair healthy and keeping your scalp producing adequate amounts of nutrients for your hair to grow. So you might ask what supplements you should take, and the specific supplements you need will vary based on your diet, your absorption levels, your lifestyle, and of course your demands. Each of you listening will have different nutrient depletions based on these variables. So it's good to get tested and look at micronutrient depletion so that a diet and a supplement strategy can be developed personally for you. If you do take supplements, please buy them after doing your research. So it's always good to do due diligence and find a brand that does not contain added fillers and binders. That's very important to note as well, because some of these binders and fillers can be counterproductive to your health. If you have questions, feel free to shoot us an email. We're happy to answer any questions that you might have. Hope you found this video helpful. And once again, welcome to Thyroid Bootcamp. We look forward to continuing to educate you about your thyroid health and empowering you with great information that allows you to take action steps towards a better you. Thank you.